You're 7 years old, there's a thorn buried deep in your foot, and it's been 3 days. The skin around it has gone hot, swollen. A colour skin shouldn't turn. There's no doctor, no antibiotic, no hospital within 100 miles because hospitals don't exist yet. You're alive 60,000 years before the word infection is even invented. So what happens to you today? You'd pull the splinter, dab on antiseptic, forget about it by dinner. For almost all of human history, none of that existed. No germ theory, no antibiotics, no surgeons. And yet humans didn't just survive that world, and they survived it well enough to raise children, grow old, and pass on everything they knew. So, how do you survive 300,000 years of infection, injury, and disease with literally nothing we'd call medicine? Start with this. The instinct to self-medicate isn't even human. In the 1980s, primatologist Michael Huffman watched a sick chimpanzee in Tanzania walk straight past its normal food and deliberately eat the bitter pith of a plant it almost never touches. Within a day, its symptoms cleared. That plant kills intestinal parasites the chimp wasn't guessing. That knowledge already existed in its troop. We didn't invent medicine, we inherited the impulse for it. Now, to actual humans. In 2012, archaeologist Karen Hardy examined the fossilized dental plaque of Neanderthals from El Cidrón cave in Spain, 50,000 years old, trapped in the build-up on their teeth. Traces of poplar bark, which contains salicylic acid, the same compound that gives aspirin its pain-killing effect. One individual had a dental abscess and a parasite that would have caused severe diarrhea. In that same plaque, spores of penicillium mold, a natural antibiotic. A Neanderthal in a world with 0 pharmacies knew exactly what to chew and what mold to use because someone taught them, because someone before that tried it and survived, and the survivors remembered. Aspirin is just poplar bark with a patent. Penicillin is just mold humans already knew, isolated and purified. We didn't invent the cure. We rediscovered it. And it wasn't only chemical. In 1908, French paleontologists found a Neanderthal skeleton near La Chapelle-aux-Saints, an old man, spine riddled with arthritis, nearly all his teeth gone years before he died. He couldn't hunt. He couldn't chew tough meat. By every physical measure, he should not have survived. But the bones show he lived for years like this. Someone fed him. Someone softened his food. There's no chemical reason a toothless, crippled Neanderthal survives an ice age for years. There's only a social one. Sometimes the medicine wasn't a substance. It was other people refusing to let you die. Here's where it gets genuinely disturbing. Archaeologists have found human skulls some over 7,000 years old across France, Peru, and parts of Africa, with deliberate holes carved into the bone. It's called trepanation, scraping through a living patient's skull, almost certainly to relieve pressure from trauma or seizures. The shocking part, the edges of many of these holes show smooth, rounded bone regrowth. That only happens if the patient survived, sometimes for years afterward. In some Peruvian skeletal collections, survival rates for trepanation, performed with stone tools and zero anesthesia, are estimated above 80%. Modern neurosurgery in the 1800s, with metal tools and actual anatomical knowledge, had worse outcomes than that. The same careful technique shows up on continents that never had contact with each other. That's not luck. That's knowledge tested the hardest way possible and passed down anyway. One more piece. Cave paintings in Spain, roughly 8,000 years old, show figures climbing cliffs to harvest wild honey from crevices in the rock. Honey has almost no water content and naturally produces hydrogen peroxide. Bacteria simply can't survive in it. Egyptians would later write this down as a wound treatment, but the practice itself is thousands of years older than the writing. Ancient humans were packing wounds with the same compound, modern medical-grade honey dressings used in hospitals today. None of this was written in a textbook. It was tested across thousands of generations, where the only feedback was whether you lived or died, and the only system for preserving the knowledge was an elder telling a child, "Watch this, remember this." Anthropologists studying groups like the Hadza in Tanzania today have documented their use of hundreds of distinct medicinal plants, passed down the exact same way it was 50,000 years ago. We imagine our ancestors as helpless against the world. The truth is closer to the opposite. They built an entire medical system without a single hospital, without writing, refined purely through trial, memory, and care for each other. We didn't replace that system. We just renamed pieces of it, put them in pill bottles, and forgot where they came from. So that thorn in your foot 60,000 years ago, you're not as alone as it feels. Someone already knows which bark to chew into a paste. Someone will sit with you while it heals, because that's not kindness to them. That's just what you do. It's the oldest medicine there is. It just doesn't come in a bottle.